Hey everyone, welcome to this explainer. I'm absolutely thrilled to have you with us today. We're jumping right into a high-yield practice session covering the absolute most important nursing multiple-choice questions for your exam preparation. Whether you're prepping for your boards right now or you're just looking to refresh your clinical knowledge, we're going to approach these questions with a confident, clinical mindset to really help you master this material. So, to get us centered, we're breaking today down into 3 critical areas: essential nursing fundamentals, critical care and emergencies, and finally, maternal and pediatric care.
Okay, let's dive into this. Starting off with Section 1, Essential Nursing Fundamentals, where we'll look at core concepts and standard precautions.
All right, here's MCQ number 1. What is the most reliable indicator of a patient's pain? Is it A, vital signs, blood pressure and pulse? B, the patient's self-report? C, facial expressions? Or D, severity of the injury? Take a quick pause right here and lock in your answer. Got it? Okay, if you went with B, you hit the nail on the head. The correct answer is the patient's self-report. Pain is, by its very nature, a totally subjective experience. And as your mentor for today, here's your first major exam tip. Always rely on what the patient tells you about their pain over any external factors, like how bad the injury looks or what the vital signs monitors are saying. The patient is the ultimate authority on what they're feeling. Moving on to MCQ number 2, think about standard precautions here. When should a nurse wear gloves? A, only when the patient has HIV? B, for every single patient contact? C, when there is potential contact with blood or body fluids? Or D, only during surgical procedures? Take a second, really think about what standard precautions actually means in practice. All right, the correct answer is C, when there is potential contact with blood or body fluids. Gloves are there to be a physical barrier against fluid transmission, so the absolute crucial word here is potential. Standard precautions depend entirely on the potential for fluid contact, not on the patient's specific diagnosis. We never wait around for an infectious disease diagnosis before protecting ourselves and our patients, right? Okay, MCQ number 3. Which position is best for a patient right after a liver biopsy? We have A, left side lying, B, right side lying, C, prone, or D, semi-Fowlers. Now, post-procedure positioning is heavily tested on these exams, so take a second to actively visualize the anatomy here. And the answer is B, right side lying. And this brilliantly illustrates how anatomy directly dictates nursing care. You put the patient on their right side to apply pressure right onto that biopsy site to prevent bleeding. Your exam tip here? Just remember where the liver lives. It's on the right side of the body. So using the patient's own body weight on that right side provides exactly the pressure you need. All right, let's do a quick mental reset as we transition into Section 2, critical care and emergencies. We're shifting gears to recognizing and responding to acute situations. Here we go with MCQ number 4. What is the first sign of hypovolemic shock in a post-operative patient? Is it A, hypotension, so low blood pressure? B, tachycardia, a fast heart rate? C, decreased urine output? Or D, cold and clammy skin? Really emphasize that word first in your mind. Take a moment to ponder that. If you picked B, tachycardia, you are correct. This is fascinating because the body is just incredibly smart. Early on, it tries to compensate for that loss of blood or fluid volume by pumping the heart faster, just trying to keep that cardiac output up. So for your exam, burn this into your memory. A fast heart rate is going to show up as an early warning sign, way before you actually see their blood pressure start to drop. Okay, time for a rapid-fire pharmacology question. MCQ number 5. What is the antidote for heparin? A, vitamin K, B, protamine sulfate, C, Narcan, or D, Digibind? Quick recall on this one, lock it in. The answer is B, protamine sulfate. It steps right in and rapidly neutralizes that anticoagulant effect. Here's your quick exam tip. Just permanently pair heparin directly with protamine sulfate in your study notes. Direct association questions like this are basically free points on an exam once you've got them memorized. Next up, MCQ number 6. What is the first nursing action if a patient is having a blood transfusion reaction? A, notify the doctor. B, stop the transfusion immediately. C, give Benadryl. Or D, slow down the rate of transfusion. Think about prioritization here. What is the absolute very first thing you do? The answer is B, stop the transfusion immediately. Halting the source of the reaction is always your ultimate priority. So the crucial point is this: patient safety comes first, period.
Your exam tip is to literally stop the harm right in its tracks before you even think about secondary steps like calling the doctor or pushing medications.
You are doing fantastic. Let's keep that momentum going as we head into our final stretch. Section 3, Maternal and Pediatric Care. We'll be looking at specialized populations and nursing interventions.
All right, here is a pretty serious pediatric scenario for MCQ number 7. A child is admitted with suspected epiglottitis. What is the most important nursing action? A. Examine the throat with a tongue depressor. B. Keep the child calm and avoid throat examination. C. Start an IV line immediately. Or D. Give oral fluids. Assess the situation. What's your move?
The correct answer is B. Keep the child calm and absolutely avoid a throat examination. Why? Because sticking anything in the throat of a child with epiglottitis can trigger a sudden, severe, and complete airway obstruction. No joke. So your exam tip here is a hard and fast rule. Never, ever insert anything. No tongue depressors, no swabs, into the mouth of a child if you even suspect epiglottitis. Moving over to maternal care with MCQ number 8. A pregnant woman in her 3rd trimester is experiencing painless, bright red vaginal bleeding. This is a classic sign of what? A. Abruptio placenta, B. Placenta previa, C. Eclampsia, or D. Preterm labor. Pay really close attention to those key symptom words, painless and bright red. Got your answer? The answer is B. Placenta previa. This condition classically presents without pain, which is exactly what helps you distinguish it from other 3rd trimester complications, like abruptio placenta, which is typically incredibly painful. So here's my advice as your mentor. Lock this association in your brain right now. Placenta previa equals painless, bright red bleeding. Wow, we've already reached the final question of this explainer. Give it one last, really strong effort. MCQ number 9. What is the classic symptom of pyloric stenosis in an infant? Is it A. Watery diarrhea, B. Projectile vomiting after feeding, C. Current jelly stools, or D. High fever? And your final answer is B. Projectile vomiting after feeding. This is literally the defining classic symptom for an infant presenting with this condition. For your exam tip, always link the diagnosis of pyloric stenosis with the keyword projectile vomiting. Fantastic job working through these critical questions with me. To wrap up today's practice, I want to leave you with a bit of a challenge. We've spent this time looking at isolated questions, but in the real world, what happens if a patient presents with multiple symptoms we covered today, all at the exact same time? How do you prioritize your nursing care then? Well, always fall back on your ABCs: airway, breathing, and circulation. They are never going to lead you astray when deciding who to treat first and what action to take immediately. Keep studying hard, trust the knowledge you're building, and I'll catch you in the next explainer.